Today we will talk about hypoglycemia after gastric bypass and especially after mini gastric bypass. Basically, we all know these days about metabolic surgery, about surgery being available to control the blood sugar levels. And mini gastric bypass is a strong tool which can very well control your diabetes. We have been doing mini gastric bypass from last more than 13 years, and we see results to the tune of 98% resolution of diabetes. But at the same time, when we are talking about diabetes being controlled, your blood sugar levels can also go down. So how to handle that? First of all, this will not happen in 99 out of 100 patients. And what we see every day, we see a very good response to the blood sugar levels. Like if a patient was taking insulin from last about 10 years, generally we see more than 95% of the patients will not need insulin after about 5 to 7 days of surgery. And that's what happens in more than 95% of patients in type 2 diabetes I'm talking about. And more than 90% of the patients might not even need the tablets. And generally they will keep showing good blood sugar levels, like in the morning, very much within normal range, and during daytime, sometimes going up a little bit, like 150, 180, and then going down. But on an average, when we look at the HbA1c levels, the 3 months average blood sugar, generally we see in more than 90% of the patients, it comes to around 6 within a matter of 6 to 8 months. But still we should keep checking our blood sugar levels. We should not take it for guaranteed that after mini gastric bypass or gastric bypass, your blood sugar has been eradicated of your body. But actually it's under control because of the gastric bypass, because you're taking less of calories and your body is absorbing less, and there are certain other hormonal changes inside the body which help control the diabetes. When the gastric bypass becomes old, say after 2 years, 3 years, you start eating better volume because it gradually dilates a little bit to the tune of 15 to 20%. And then patients start eating like a moderate amount of food with ease. And if you are taking high concentration of carbohydrates, say if someone is taking 2 chapatis in one go, or some parantha like we take in North India, this diet is very common, or if you're taking a lot of rice. I mean, if your diet is like more than 70% is having carbs and 30% other things, then what's happening? Your intestine is right away getting the carbohydrates, and it's going to send strong signals to the pancreas, and pancreas will in return produce more insulin, and which is going to control your blood sugar levels, and which can eventually cause rebound hypoglycemia. So eating too much of carbohydrates or too much of sugars, like taking 2 cups of ice cream in one go, can bounce back actually, because it will send strong signals to the pancreas. Your food is going into the intestine, and for intestine, this sugar is something new, because intestine is not used to handling high concentration of sugars. Earlier the food used to go into the stomach, and then it will gradually go into the intestine, and now your food is right away touching the 5th feet or the 7th feet. It depends on how much bypass has been done. So accordingly, your intestine will respond to high concentration of sugars or high concentration of carbohydrates if you're eating, and that can give you a difficult time after, say, about 1 or 1.5 hours of eating that. And you must check your blood sugar levels at that time. And then at that time, what you need to do is you can take some mix of sugar and salt. Add some sugar and salt to water, add some lemon, and you can take that solution. Or you can have some fruit like apple or banana or curd, anything, it will help. If you're taking sugar candy, which is again having high concentration of sugars, then again after 2 hours of taking that, again you might have low blood sugar. So we should not try to fix the low sugar with too much of concentrated sugar. Just try to have anything with little bit of sugar and some salt as well, so that your intestine should not respond again in a sudden manner and should not cause hypoglycemia again. So this is how we can avoid hypoglycemia after gastric bypass. This is not a common problem. It will happen to maybe 1 out of 100 patients, but we want to see every patient as a happy patient, and it will be good to know that in 1 out of 100 patients, this is possible, and this is how it needs to be handled. And another thing, you can have something every couple of hours, like every 2-3 hours, you can have some little bit of fruit, or sometimes curd or yogurt or buttermilk, or some vegetable, some raw vegetable, whatever. I mean, not full of oil or carbs or sugars, just something normal, having high fiber content, every 3 hours or every 2 hours. So small, frequent meals, which should be low in sugar and low in carbs, will help you maintain good blood sugar levels and will help you keep away from hypoglycemia.